Hello, Dr. Lessard and class. So today I'm going to be talking about my strategic plan for our medical group education and training department and my goals and objectives for maintaining clinical currency and enabling a zero harm culture. So we started out with a SWOT analysis of looking over those goals and objectives, and we determined our strengths were that the department was fully manned, giving us the capability to be able to maintain and run a multitude of programs that we have here to be able to fulfill our goals. So classes such as our BLS classes, our CPR classes, and then also our EMT classes and any other classes that we would need, such as team steps. We have been able to establish our relationships with the hospitals and our local surroundings, who have been able to give us the capabilities to send our providers, our staff, our nurses, anybody else that has any clinical classes that they need to obtain to for a limited cost or no cost, because we have a memorandum of understanding with them. We've identified tracking systems in order to maintain records of their certifications. So those are some of our strengths. Some of our weaknesses that we have that I have identified is that not all personnel, when they come and check in here at the med group, are coming actually out here to education and training. We are isolated, and on the checklist they aren't seeing us, or they aren't coming to check in, so we aren't able to capture their certification dates, thus not being able to put them into the databases, and then us not being able to track them properly. They're not keeping up with their own clinical competencies, keeping up with their dates, so they are going expired. And then we're having to try to find them classes at the last minute. We just recently lost our training site for ACLS, so that means that we lost our instructors, and then we have to send people out into the local community to find ACLS classes. Some of our opportunities that we have here is our ability to send our staff to different instructor courses throughout the Air Force, and then also at different facilities in the local area. So then when they send them to the other courses in the different places, they can bring back their knowledge to our facility. We can increase our training needs, our training stuff with our local facilities. Like I said earlier, we can establish relationships and then bring back the training, have cheaper training because we have the memorandum of understanding. And then some of our threats that we have here, I am going to be retiring, and so I've been working out here for almost 2 years. So I have a vast knowledge of programs, and I'm actually also in charge of quite a few programs. So I'm trying to pass those on to the new personnel that actually have moved out here. They've been here for almost 6 months. So trying to give them the knowledge and give them my programs, and then find out who is going to be taking over my programs and my job to give them and pass on and have a good turnover. And then keeping up dated supplies. Programs change, books change, supplies change, so keeping up with that. Our leadership tends to not think of us during their budget meetings, so we need to make sure that we are thought of and let them know that our keeping up our information helps keep up with patient care abilities and staff patient safety, things like that. So then we get into our budget, our strategic plan, our strategic goals, and looking at that. So our business goals are going to be, our financial objectives is maintaining our budget, to utilize training through outside agencies. This keeps our costs down. Our customer perspective is providing customer service and training to all employees. This helps them understanding that we have our customers, our outside customers, which are our patients, but are also our internal customers. Ensuring that our competencies are tracked, and ensuring that everybody gets all the needed Joint Commission, our OSHA, our Med Group, and our Air Force Medical Service trainings within 30 days of arrival. Those are things that we can be dinged on in inspections, and ensuring that everybody receives that within 30 days, whether it's through the newcomers process or whether it's sitting down and going through the booklet that we have, and then returning back and actually sitting down and going through newcomers briefings. Our internal process is our perspectives is our newcomers process. Re-looking at that process and ensuring that everything's covered, and that we can limit the time that they're here and that they're actually getting the briefings that they're needed, obtaining their certifications when they do come to newcomers, and then our learning growth perspective, ensuring that they get their mission, vision, and goals during newcomers, and then provide quality team steps and understanding. And so looking at our action plan, we want to manage the budget by using the analytical managerial decision making, because we're going to look at data and ensure that we find the best solutions based on that data, and go ensure that we have the best prices. We have the customer's perspective objective, and we look at the management by means with that one, and then utilizing the conceptual managerial style for revamping the newcomers process, because there's so many different people in the pot, and so we're going to have the heads of the different departments that need to be involved and bring them into the processes. And then with our leadership style, we want to make sure that our leaders, when they come over and brief newcomers, that they're emanating the authentic leadership, because if they are authentic in what they're briefing, then the newcomers and the new personnel that are here are going to pick up on that, and they're going to follow the mission, vision, and goals that they're being given, and understand that process. And some of the stakeholders, when we did our stakeholder analysis, come into the communication plan here. So our stakeholder analysis was going to be actually everybody in the whole facility. And most of them are going to be our key personnel. So our commanders, our squadron commanders, our flight commanders, our superintendents, our flight chiefs. So they are going to be in it. So we need them to actually be main parts in our communication plan as well. So we already have a Thursday morning meeting. So in those Thursday morning meetings, we brief our processes and our stats once a month. But in those Thursday morning meetings, we're able to bring up any issues or anything that we want to tell our leadership about, or if we're having any issues. So what we can do is bring up these new things that we would want to discuss with everybody and ensure that it gets down to the lowest level. So we would bring up these issues, and what's supposed to happen is the people that attend these meetings, the commanders, the squadron commanders, the flight commanders, the superintendents, the flight chiefs, they then bring it back to their clinic, people that run the clinic, and then they bring it back into their huddles that are the providers, the nurses, the technicians, and they discuss their issues, and then they bring it back to just their teams that are the the volunteers, the admin technicians. If it has to go into the radiology department, they discuss it there, the lab, and they bring up what was discussed at the leadership meetings. So our issues can get brought down to that. So that would be our communication plans. We can also use mass emails. We send those out as well. For any new trainings that we would be sending out, we use a Swink Health, which is a training site that we can implement training. We can send, make up new PowerPoint trainings and send those out to ensure that people have been tested on training specific for our squadron, our unit, our group. Air Force Medical Service sends out training there as well. And then to evaluate and ensure that everybody has received this information, we can use a tool called SurveyMonkey. And we can make up a little survey, send out the link to MedGroup All, and ask them their job title. And then with that, we can ensure that it's gotten down to, see what level it's gotten down to, and ask them the question, ask them certain types of information, and seeing what type of information they've received, and see how far the information has gotten down to. So that would be a tool in ensuring the evaluation stage, and then seeing how far the information's gotten down, and seeing if they've received the information that we want them to receive. So, thank you for listening to my strategic plan.